Page 33. Glenohumeral joint. Anterior glide at 90 degrees of abduction. Purpose: to increase external rotation and extension to reduce a posterior positional fault of the GH joint. Precautions: the anterior joint capsule is structurally lax. Watch that you don't hyperextend your wrist with your mobilization.
Okay, so I've rolled up a towel nice and tight with a couple of elastic bands around it, and that gives us a nice firm block. We're going to place that right underneath the shoulder, like so, right underneath the coracoid process, and that stabilizes the scapula and the shoulder girdle. Place the forearm across your thigh and bring the arm up to 90 degrees of abduction. Then we can control the degree of external rotation just by bending the knee, like so. To be effective, what you should do is take it up to point of restriction and then back it off about 10 degrees. Once you've got that position, traction or pull on the humerus. Place your mobilization hand just off of the scapula, so slide it down till you get to the joint line, which is right here. Place your hand flat across the posterior aspect of the humerus, and then you're ready to perform your mobilization. So I'm going to be pressing anterior and just slightly lateral. So first again, traction a little bit, and then anterior and slightly lateral. Pressure on and pressure off. I'll go through the grades for you again. So grade 1 is just the initiation of motion. Grade 2 takes us up to the first tissue stop. And grade 3 is the corrective grade, so we want to put enough pressure to stretch the capsule. Grade 3. Go nice and slow and take your time. One more. And then place the arm back to the table.
Helpful suggestions. Rest patient's forearm on therapist's thigh. Therapist positions the arm into external rotation by flexing his or her knee and hip. You can adjust the degree of external rotation by increasing your knee flexion. Apply a lateral traction first before doing the mobilization, as this makes the mobilization easier and more effective.